Oh, it's amazing how things can just go from flying on the most beautiful trail to just tumbling down a cliff. I mean, I bounced on my head and on my rib. So I'm gonna ride slowly for a little while, see if I can breathe, and yeah, then decide what to do.
What do you do when you hit your head? As we talked about in episode 1, Rebecca self-assessed, got herself to safety, and basically chilled for 10 days. But as we talked about last week, things didn't get better. And she's not alone. A recent study of people with mild traumatic brain injury, aka concussion, reported that 47% were still experiencing symptoms like depression, headaches, fatigue, and cognitive impairment 6 months later. And for some people, like Rebecca, those symptoms can linger for years. When that happens, people get desperate and start trying anything that friends, family, Google, or various health practitioners recommend, which is exactly what Rebecca did over the past 2.5 years. I'm Celine Yeager, podcaster, health journalist, and longtime friend and past teammate of Rebecca's. And through this 4-part podcast series, we take you through Rebecca's journey, including the treatment she sought and conversations with leading experts about how they're treating concussion today. Today, we focus on Rebecca's desperate journey to resolve her persistent post-concussive symptoms, and we sit down with Dr. Alicia Trbovich, who is a neuropsychologist at the UPMC Sports Medicine Concussion Program, who studies the management of sport-related concussion and neuropsychological assessment following mild traumatic brain injury. She explains how leading institutions are very actively treating concussion today. Okay, welcome back, Rebecca, to the next episode of Brainstorm. And what a storm it is. I went back. We have kept a spreadsheet. Era, the lovely Era has kept a spreadsheet helping us with this of all of the modalities that you tried along your journey here to get better. And I guess, like, when did you recognize that you needed to seek out more care? Was it like right away, or did it take some time for you to be like, I'm not getting better here. I need to get boots on the ground and see what I can do?
Yeah, I mean, initially I thought I was fine. I was more concerned actually about my ribs being painful because I was kind of really apparent and the kind of injury that you feel. And it was really I didn't go to seek medical help until a couple weeks afterwards. And that was the prompting of my coach, Tim Cusick, who was amazing. I mean, I've worked with him for years as my athletic coach, and he knows me really well. And he talked me into like, you should just go and get some baseline stuff and so it was really, I started to get some care a couple weeks in, but really it wasn't very definitive care. I went to my primary care physician, was not, I asked for an MRI and they said, well, it won't help because you don't have a baseline and you're not on the ski team and da, da, da. There were all these reasons why. And they checked my ribs and did some blood tests to see if there was, blood in my urine or anything like that, or kidneys that might be damaged. And that was kind of it. And then I was sent home and was like, okay. And I could just tell that I didn't feel like myself. And luckily I had my coach and Era who works with me. She's my COO. I had some people really close to me who, as you mentioned earlier, started keeping notes and started keeping records for me that were so valuable. But I mean, Era was covering for me at work. My coach Tim was trying to be supportive of my mental state, my physical state, and sort of gently pushing me to get moving again. But I really wasn't myself. And I look back at my journals and I think I even wrote like, who am I? Like, who is this person? Um, and that went on for the better part of a year. I started reaching out in that first year, 1 month went by, 2 months went by, and I started asking and reaching out to my network. And And one of the first things that somebody recommended was hyperbaric chamber. And so there was one locally here nearby, and I went and I did the protocol, which I can't remember. I think it was like 12 consecutive sessions, or, it was a commitment, and you stay in there for 45 minutes or something like that. I know some people um, have seen positive effects from that, and there is anecdotal evidence of it. I don't know if there's scientific evidence of it. I didn't really notice anything. And you go in and they basically, like, it's pressurized. So it's like you're going scuba diving, but you're in a hyperbaric chamber. So they take you down as if you were, underwater, and the pressure changes in your brain. And I don't know the total science behind it, but
Does it feel
it's
like you're in an airplane or a submarine? Like, what does it feel like?
it feels like when you go underwater, you know how your ears sort of pop,
Oh, I
or
do.
when you
Yeah.
go up. So
Yeah.
either up or down. So it's similar to an airplane going higher and pressure changing, or going underwater. Like if you
Mm.
scuba dive and you've got to pop your
Yep.
ears and you've got to do that. It's actually the same sort of protocol that they give you as if you were diving.
Yep.
And then once you're in there, like, it doesn't really feel like anything. Like, I would just sit in there and read a book. And probably the most thing I felt is that I relaxed for 45 minutes and read a book, which was probably really relaxing for my brain. But as far as feeling like really changed from all of that, I didn't,
Yeah.
and they did some eye testing and some stuff like that before and after. I didn't notice a lot of that protocol. It was a little bit expensive. Luckily, I could do it locally. So I tried that. I tried some Ayurvedic therapy with a woman that I had been working with from India, who talked all about certain foods and, your things like that, and supplements. And, I tried some of those things, and I think there's a lot of health benefits to that kind of eating and protocols. But again, I didn't notice some huge big change. And um I went back to the primary care physician, I think a couple months, and said, I'm still not myself. I'm not motivated. I, don't want to get outside. I'm not sleeping well. I can't get out of bed. I can't work. And they prescribed antidepressants, SSRIs, which I didn't take. I didn't want to take them. I know they're valid for a lot of people, but I just felt like it was a little bit of a stab in the dark, which it was kind of the theme for all of the therapies that I've tried. Like, try this, try that. And so while I was happy to be experimental with some of these other things, I wasn't willing to be experimental with
Mm.
SSRIs, because I've heard a lot of horror stories from people. And I just didn't feel in my gut that it was the right protocol for me at that time. Um, in subsequent visits, that's what everyone kept prescribing,
Mm.
multiple times over. Antidepressants. And yes, my symptoms were very much depression.
Yeah.
And very much mimicking, what SSRIs could help with. But I was more interested in finding a different way to release serotonin and, have the brain work on healing itself.
Hmm.
So I went to this other modality called wave neuro. That was through a connection through one of my sponsors, and they have some really interesting protocol there. They did do an EEG, which was great. I couldn't find through Red Bull, I'd had previous EEGs and some brain studies through the Red Bull high performance team. I couldn't find any of those. They were more than a decade old, but I really tried to go back and find those so that I would have this quote unquote baseline. But Wave Neuro, they do EEG, and they really look at, your alpha, beta, theta, like, what is your brain doing while you're sitting there basically for 20 minutes. You are supposed to relax, but not fall asleep.
Right.
And the results of that, I'm trying to remember, were that, and I might get it wrong, whether I think our beta are the really active ones. Is that right?
Yeah.
The beta.
Yep.
So I was really activated. The beta was really activated, and I didn't have alpha and theta, even though I was just sitting there trying to relax. My brain was just kind of like, zzz, which is what I felt like during this whole protocol, or during this whole attempt to recovery. It was a really cool protocol. The problem with it is that, you have to go and spend like 6 weeks with them and do multiple protocols, every day for a certain amount of days. They were working on a home unit that maybe they have one now, but it just was out of reach for me to
Is
go
the
stay.
idea to change your wave activity?
Yeah, so you wear this little helmet and you sort of do these sessions that I believe are kind of helping you get back into your brainwave alignment.
Gotcha.
Uh, and what was interesting is from some of my old Red Bull testing, we did some of this really cool brain work ages ago on health, when I was competing a lot, and we actually played video games without touching any controls.
I've done that. It's amazing. You're like guiding something through yeah.
Yes, it's very cool. And what
Mm-hmm.
they saw in my brain at that time was that I was very good at staying super, super focused for long periods of time. But then when I was done, I would crash and couldn't
Yeah.
like come back again. And so I thought about that in this
Hmm.
way of neurotherapies, of how it's helping your brain. And I don't know the science behind it, but it sounded kind of legit, of helping your brain sort of do exercises in a
Yeah, yeah.
way, practicing. But it was out of reach, for me financially and schedule wise. I couldn't make that happen.
Yeah.
I think there's a lot of really cool therapies with light and frequencies and things that are happening. I just don't know enough about them, and I didn't have the money to keep experimenting in that area. So back to the drawing board. I also had the chance to talk to an epigeneticist,
Hmm.
this guy Mansour, who is amazing, and he was doing a study, a clinical study, and so he did a DNA test on me and looked at my DNA and saw some things in there with my hormones that preclude me to have bigger effect, from that explained to him why I had such long-term ongoing concussion symptoms. He could
Such
see
as, like, can you give an
such as
example?
the way that when I produce testosterone, I produce it very well. I don't, though, convert it to estrogen very well. And he was explaining to me how estrogen is sort of neurogenerative,
Mm-hmm. Mm-hmm.
and that even before my concussion, I was not producing
Interesting.
estrogen in this way. And it's just like part of who I am. And that was a real eye opener of like, oh, like my body could tell me ahead of time that I'm going to have long-term effects. I don't really know what to do with that information. And we did a whole supplement protocol, and, again, invested a lot of money in some of that stuff that I don't know if it was working or not working. Um, I think if I were able to spend a lot of time with him, he could have customized a protocol for me. But
Yeah.
again, it was like, this was a amazingly like researched doctor who's out, he's got his own life. I'm not his patient. And so this is kind of the moral of the story, or a theme, is that I had little dribs and drabs access to some really cool things, but no one to help actually guide my recovery and personalize it for me. And so I like have this little thing I try there and this little thing I try there. And then I just be like, I don't know, I'm exhausted. I can't research epigeneticists. Like I can't research the frequency waves of brain waves. And I didn't feel like I had an advocate or somebody who could help sort of crystallize the information for me. But that was really interesting. I will say a really big turning point in my recovery and was a year later, a year after the concussion. I was referred to Dr. Kutcher, the Kutcher Clinic in Salt Lake City, Utah. And this was from a former coach of mine, Dean Gollich. He's like,
Mm.
go to this guy. He specializes in concussion and he works with athletes. And of course, he works with the US ski team and, he works with a lot of people who are crashing all the
Yeah.
time and works with athletes. And so I was like, okay, I call him up. He had availability. I went and stayed in Salt Lake City for 2 days, saw him 2 days in a row, drove over there. And the first thing he did was, he ordered an MRI, and which I was like, great. He also did a bunch of eye tests. He did,
Mm-hmm.
quite a few different eye tests. And they did the test, fatigued and not fit. So while I was exercising, and then also in a rested state, because was happening to me at the time is I was afraid to go out and work out. I was afraid to get my heart rate up because
Mm-hmm.
still was having headaches. And, I was nervous that I was going to hurt myself and literally blow my brain apart or something if I got too much pressure in it. And I had all this fear about going out and training. And so they did some really cool tests. Yes, under load, not under load. And basically, and he also checked my neck, which nobody had done. He asked me the mechanics of my fall and how did I fall and which way did I fall, and had a PT look at my neck. And I was just for the first time like somebody was listening to me and actually personalizing the care a year later. So on the second day, the MRI came back with no structural damage to my brain. And it was weird. He like pulled up this big screen and it was like, showed my brain. And even before that, he had gone through and drawn on the board. This is how your brain works. This is how your nervous system works. This is how the communication happens between your eyes and your proprioception and your neck. And he explained it all to me. And I was like, oh, okay. And his PT guy was like, could tell, he did a lot of eye and proprioception stuff with my neck. And he's like, no wonder you have headaches. Your neck is totally messed up. And so that combined with a healthy MRI, I saw the healthy MRI and he said, your brain looks great. And I actually was disappointed, which is so weird. I mean, I was relieved because I'm like, okay, good. But
Yeah.
then the
But
second
what's
thought of,
wrong?
well, what's wrong with me then? And I even asked him, he said, structurally, your brain is great. And so I actually started to cry and I said, so do I just need to take antidepressants? Is that what's wrong with me? And he said, no, 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 no. He said, he was the first one who said, I wouldn't prescribe that right now. And he said, first, you need to fix your neck because that is causing probably a lot of your headaches and
Mm-hmm.
other things like that. And second, you need to get moving and exercise again. And he said the test that we did show that, you're fine to exercise, like you're not going to hurt yourself. And that was a real shift for my nervous system to one to be like, okay, one, I'm not making this up. Two, I have a healthy brain structure. Three, I'm given the okay to exercise. Four, I'm given something to work on with my neck. That's maybe a reason why I have headaches. And I was just like, thank you. So it took a year for me to start to have a turning point. I will say Dr. Kutcher wasn't the full meal deal. Like there were still, like he sent me away. We had a bunch of really great follow-up calls. He encouraged me to like play music, do art. He recommended a couple board games. So he was definitely recommending protocols to sort of exercise the brain. And then he had a long conversation with my coach, Tim Cusick, and kind of pushed on Tim. He's like, you need to make her exercise. You need to push on her. And Tim actually, he felt badly. He's like, I'm sorry I didn't push you further, but like, he's like, I'm not a specialist in this area. I didn't know what
Totally.
to do either. And so we both kind of got the go ahead to exercise, which was a real turning point. It's not to say, I mean, that was a year in, and now I'm 2.5 years in. I'm still healing, but that was a really big turning point. After that kind of go ahead to get moving and work on my neck, and I went to a physical therapist and started really, really getting rid of some neck issues that I think have been there for a long time. And that's when I also met Dr. Edith, who has a protocol called Rev 6, and she's all about, she's designed all these exercises for the nervous and the fascial system, which is really interesting because I still was calling calling friends and colleagues and be like, what do you do for concussion? What do you, because I still felt like there was something missing for me. Yes, I could go exercise, but I was still lethargic, still not motivated, still getting some headaches, and yeah, working on my neck. But I felt like it was deeper than just getting my neck fixed. Um, and and so I found Dr. Ida through a referral from another friend, Stephen Kotler, and she we did one Zoom session, and she looked at my eyes, had me do this, 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 and this. And she was like, oh, okay, I can help you.
Yes.
Well,
So
anyway,
yeah,
it
she
was,
had you move your eyes. Were you following her fingers?
yeah, she had me follow her fingers, look right, look left, like, turn my head on one Zoom call in 5 minutes. And then she had me walk for the camera back and forth. And she said, great, I can help you. Um, And I didn't really know much about her system, but I was pretty desperate at this point. I was like, I need some help. I got the clear from Dr. Kutcher, but like I still need something to do. So I went and did a 4-day immersive in California with her where she works on you for like 8 hours a day, and takes you through these exercises. She does a lot of fascial release, different exercises for balance, for proprioception, for moving in different planes. And, the way she explains it is, our nervous system is, controls our whole body from the brain all the way down to the soles of your feet. And your eyes really literally are the windows to your brain. But she has a whole system that is connecting, like through your hands, through your feet, through your spine, through your neck. And I've been doing her exercises, pretty regularly every week since then. And that has provided a ton of relief. And in in ways that I probably had, tightness and stiffness and blockages for years as an athlete who's used to going kind of in one plane. She's all about, you know, moving side to side and in all sorts of different ways. And now even when I go running, I like do side running, and I like, it's a reason why trail running is better for your brain than running on a treadmill. So kind of learning all these things that your body needs to move through space. And if there's a blockage, it makes your brain really, really tired.
Hmm.
So if there's a blockage in your neck or something in your hips. And so she's been amazing. And there are exercises you can do at home. It's none of these protocols now that I'm doing, they're pretty subtle. But I can tell that the Rev is working. I also started getting on a supplement protocol from Momentous that was basically designed by football players and people, post-concussion. And there's a lot there, I will say, as far as the studies and things, there's a football and UFC have done like the most amount of studying on brain injuries, but like I don't know how to crack through all that science and everything.
Military.
So
Yeah.
yeah, in the military as well. And so their supplement protocol, creatine seems to be the one supplement that has more than a decade of research behind it for sort of cognitive health. So they were like, get on the creatine, so I've added that. Dr. Edith made some supplement recommendations as well. Uh, Vitamin D, omegas,
Yeah.
those kinds of things that you've talked about a lot in your podcast, but I just didn't know. And it's
Yeah.
also same, like, I don't want to take 10 billion supplements. I want to take the ones that work.
Yeah.
And so I was appreciative to see a actual protocol, and one that's like what you do immediately versus what you do 3 to 6 weeks out, and then what you do ongoing
Yep.
For your
There's
health.
very good research on creatine and brain health. Like that
Yeah.
is, yeah.
And I appreciated that, because then I'm like, okay, this is researched.
Yeah.
And it's not just me spending money and taking something that I don't know if it's going to work. And that has been a frustration through a lot of this, is that I just have not gotten good guidance. And quite honestly, it was so exhausting to try to weed through all of the research and the stuff. Um, and I eventually, friends of mine were the ones who sort of guided me in the right direction. I will say something that was really critical for me. I did do acupuncture and actually had some really, really good sessions there, especially with my neck release, but also with, and I believe this energy flow and brain flow and blood flow, kind of like Dr. Edith's protocol. If things are blocked, you don't feel good, whether it's, your nervous system not communicating all the way through, or whether it's muscles that are blocking it, or fascia. I've become a lot more aware of, opening up channels, and acupuncture was really good for that. And that has helped me a lot. And then, yeah, about a year plus in, I also started going to a really good therapist who deals with trauma. My acupuncturist referred her. And again, it's people you trust. I trusted my acupuncturist. She knew this therapist. And so I trusted the referral, and started doing talk therapy with her, and with this woman who specializes in trauma. And we talked about the concussion. We talked about, a lot of things, but I was pretty regular with her for more than a year. And actually that has been, I would say, if I look at sort of the buckets of my therapies, it's like the first year was just sort of like grabbing at straws, of I don't know what to do. And, primary care physicians just keep saying, take SSRIs, and then, really and a stab in the dark with lots of different protocols of things. And then going and getting the clean MRI and sort of at least structurally healthy go ahead. And then the second half of that, the sort of protocol and recovery has felt a lot less like throwing darts, with a blindfold on. The first year felt like that. Then I got a healthy sort of, okay, onward. But I still knew I wasn't structurally, I was fine, but I wasn't fine. And then so the sort of second year of therapies have felt much more guided and intuitive and researched, as in creatine and talk therapy and some other things like, Dr. Edith's work with fascia. And so the second half of the therapy has felt more guided and more productive. I consider my nutrition and lifestyle healthy and sound, but many of us, me included, still don't get all of the essentials for optimized health from diet alone. I've always dabbled in supplements, but recovering from a brain injury with years of ongoing symptoms really forced me to hone in more precisely on what my brain and body needed to heal in the short term and also to thrive for the rest of my life. Creatine, omega-3, and vitamin D are 3 nutrients that expert research shows to be helpful for cognitive recovery and foundational for long-term health. Creatine is integral for energy production in cells, including those in your brain and muscle. Omega-3s are critical in impacting inflammation, muscle recovery, and brain health and function. And higher concentrations of vitamin D improve muscle strength and power, sleep quality, mood regulation, and support the immune system. These 3 supplements are now pillars of my daily routine. But look, not all supplements are created equally. Momentous is a company determined to bring trust and transparency to the supplement space.
All of their formulas are designed with human performance experts and are NSF and Informed Sports certified for use by professional and collegiate athletes. They call this the Momentous Standard, and it's become synonymous with the industry's gold standard in quality and efficacy. So if you're like me and you want to support your brain and body with supplements made and used by the best, go to livemomentous.com and use the code BRAINSTORM for 20% off all of my favorite products. That's livemomentous.com with the code BRAINSTORM.
It's pretty clear that Rebecca became increasingly despondent and desperate as time went on and her symptoms persisted. That's something Dr. Alicia Trbovich sees regularly. She's part of a concussion care team at UPMC that wants to help medical professionals better understand and manage concussion care. Alicia has completed expansive research in risk factors influencing concussion recovery, treatment protocols, behavioral management and intervention, and concussion outcomes. We talked about how concussions manifest differently in different people and what personalized concussion care looks like. All right. Well, thank you for joining me for this podcast series, Alicia. I saw you speak at the symposium in Philadelphia along with Christopher Vaughn, who I've also interviewed, and I was like, wow, your group is doing such great work. So I'm really excited to have you as part of this conversation.
Well, happy to be here.
So I sent you for some background, all of the things that Rebecca Rush, the protagonist of this episode, has done, and she has done an awful lot of treatments. I mean, the list is long. We talked about them all. Her and I did on a previous episode. I'm curious if you do have thoughts on any of these that I sent you, and also, how often do you see somebody come through your doors who has just tried everything under the sun?
All the time. So because we have an out of town program where we have people come and do a whole day of testing and then develop a treatment plan. We get people from all over, like the state, country, internationally, because this is very common to when after your concussion symptoms don't resolve after a few days or a few weeks, whatever it is that you think is the preconceived notion of how long they should take to go away, then you start to get desperate and look for anything and everything. And I think a lot of times if you've exhausted all your local resources, the easiest thing to do is just to go online and figure out what you could do. And a lot of times, then you don't have to travel or whatever. And so people do all this random online programming. Really, they do whatever vibes with them. So like, meaning, some of the treatments I looked at, that Rebecca did was like very natural, which a lot of people want. They don't want a lot of medicines thrown at them. They don't want a lot of invasive medical procedures. They want to do stuff that's like, again, what they feel is probably a healthier route. And so I see a lot of that alternative treatments, which often don't hurt, but there's just no research to show that they do anything. So, anecdotally, sometimes they do, but so I see people like, I got desperate. I tried this or this, the hyperbarics or the, what was some of the other ones? So, like meditation, that can't hurt anyone and that can be good for you. But, does that have any evidence that it like cures a concussion? Well, depends on what concussion problems you have. And I see random stuff all the time, or, different supplements, or I'm trying to think what else alternative stuff people do. There's a chiropractic chair out there that spins you around and like that. And I'm like, well, I don't know how that would work, mechanistically, but people report benefits. So yeah, I see a variety of things. I see people seeking all these different treatments. Sometimes they have some success, sometimes they have no success. And that's why they end up at my door. And, again, they have to travel and do this whole day program. So I think a lot of times you see people going online or trying to do stuff through telehealth because it's the easier barrier of entry and they're hoping that'll take care of the problem.
Yeah. And, when I saw you talk and I saw your group talk and I looked at how you're sort of treating symptoms, which we'll talk about in a bit, some of this stuff did make some sense. She was doing like some eye exercises and some people had her doing PT, and like through the throwing the darts at the wall, some of the things hit. close to like where they should
Yeah.
be treating. But there was no sort of comprehensive, is where I think that missed the mark. There was like where I think your group does that full extensive, like, here's what you're experiencing, let's take care of these things.
Yeah.
It's harder to do that on your own when you're just literally, like you said, you're online just sort of throwing darts at a wall.
Yeah, and sometimes these programs are very like cookie cutter. They're like, this is what we do. You do this day one, and
Yeah.
some people, like you said, some people have ocular problems and they absolutely need the treatment for the eye tracking and such. But then there's other people who that's like was either only affected at the beginning or and has resolved, or like you just can't just throw everything the same thing at every concussion patient, especially a long-standing concussion patient, and think that you're definitely you might if you're comprehensive, but why are you going to waste their time doing stuff that's unnecessary?
Yeah.
For one, and but yeah, and then there's the expertise that goes with it. So for example, I see people say, oh, I did vestibular therapy already. Well, it turns out they did vestibular therapy with somebody who did one day of training in PT school on how to do, they learned how to do vestibular therapy, but do they really know how to do it for a concussion patient? You can do stroke, you can have vestibular therapy for strokes or other neurological
Right.
conditions. And sure that they could have had experience doing that, but that's completely different than concussion, I've learned.
Gotcha.
It would be like me as a neuropsychologist, all of a sudden starting to treat dementia. Like, did I learn about that in school? Well, absolutely. But do I see that every day? Not even close. So I wouldn't try to say, oh, let's apply what I know to a dementia patient. I don't, that's not appropriate. So I see a lot of that too, where someone thinks, oh, well, I did this a day in school. I kind of remember, let me do this with this patient. And then they're missing the mark.
Gotcha. So a couple of broad questions before we kind of get into it. You said people come to you when they're still experiencing symptoms longer than they think they should. Do we know the time frame within that a concussion should resolve? The symptom should is that
So we have research that's on what we call recovery curves, right? Where you look at each time point, like 1 week, 2 weeks, 3 weeks, what percentage of people are recovered, or and it gets really messy because you can measure things in different ways. What is recovery? Is that absence of symptoms, absence of impairments a medical provider can find? So not to get too deep into the woods here, but when we look at kids, we actually do have pretty good recovery curves, so to speak, that say most kids, especially if you're healthy, recover in 2 to 3 weeks. If you have some pre-existing risk factors, like maybe you're prone to migraines, have anxiety, then maybe you might be more like 4 weeks, 5 weeks. But then you look at, okay, most upwards of 90%, 80-90% are better in 6 weeks. And then it tapers down. But so yes, but then once you get into adults and you see more various mechanisms of injury, like you have these more uniform sports injuries, which are, there's always exceptions to the rules, but are typically not that severe, so to speak. Whereas, you can see high-speed motor vehicle collisions or, really bad bike accidents, falls from really far, and you just lump them all together, and then you're surprised that the recovery curves are dramatically different. So we don't have good data. So I hate that question. And I tell patients we don't have good research, and it doesn't matter anyway, because you're the individual and you just want to know when you're going to be better. But generally speaking, if I have to lump everyone together and you're an adult, a few weeks to a few months, you could do everything right and still be not better for a few months. And then, I see people who come to us a year or two after, and we can still help them. It's sometimes a long journey, and people can continue to just get better for years. But I don't tell people, oh, don't worry, you're just gonna keep getting better for years if you do nothing. That's not really true. So yeah, you asked the hardest question there is, but few weeks, few months, usually that would be the most normative recovery curves.
I know a couple of women, because being a former bike racer myself, I do know, and they are all women, to be honest with you. I know I can name 2 to 3 off the top of my head who have, like Rebecca, like a couple of years later are still not what they would consider okay. They're still, do we understand what makes somebody vulnerable to that persistent post-concussive symptom, situation?
Yeah, well, we have an idea of some risk factors. I mean, to speak generally to the woman thing, there is, younger, it's inconsistent. Do girls take longer than boys? There is emerging research more on how women are different, hormonally, driven differences, and how that's actually even affected after a concussion. It's definitely a new area. I can't speak too much to it because the research is really still just showing, oh, there's differences, or, oh, look, if you get injured a certain part of your menstrual cycle, you might see some delays in it, but it normally returns to normal in the same time frame that is recovery occurs, in a few weeks, few months. But beyond that, yeah, we know there's a bunch of like individual risk factors of pre-existing conditions, because concussion really is this general energy problem with the brain. There's no structural finding, there's no certain special area of the brain that's damaged, so to speak, but it's this like cerebral metabolism of the whole brain. So if you have something going on that's already kind of a weakness, neurologically speaking, like you're prone to migraines, there's something that happens neurochemically that seems to make you more vulnerable or to getting migraines post-injury, and that can slow your recovery, because one, if you're getting a migraine all the time, you have a hard time engaging in rehab. And then you're separating, is it a migraine or a concussion? And you're still, it doesn't matter. You're still symptomatic and not feeling well. So I don't deem that person recovered. So like migraines are a big one. Anxiety is a big one. And depression.
That came up in the symposium that I thought was interesting.
Yeah. So there's a few things there. There's one, the way that people that are prone to that respond. So meaning if you're an anxious person that tends to be panicky in situations, then when you have like a vestibular problem, you're more likely to get more panicky, because that's the natural mechanism of when you have a vestibular problem. So you're going to then alter your behavior to minimize some exposures or environments because they bother you so much. And then that can hinder your recovery. There's also probably something more biological, because their nervous systems are just like way more sensitive. So, and, neurochemically speaking, people with anxiety are different. So that's, the expression in the human experience of anxiety, but then what's going on in the brain that's different. And, there's at least some evidence that there's different neurochemical processes. That's why SSRIs work well, but more sensitive systems tend to lead to more difficulties post-concussion. So I see things like, well, I've always been prone to getting anxious or stressed easily, but now when I get anxious and stressed, I get a headache, which I didn't get that before. So like post-concussion, now your expression of anxiety can kind of change, and stress can cause different things because of the altered chemistry in the brain. So a stress can cause anybody a concussion headache, can be a trigger for a concussion headache, but I definitely see that more upon people who are already leaning in that direction.
It makes me wonder, honestly, Alicia, if somebody, and these are hyper-focused athletes that I'm talking about, if there's also a little element there that they're so hyper-focused on and tuned in that their brain is just not okay with anything that is, you know what I'm saying?
Well, 100%. And, in my opinion too, on that is, you don't become an elite athlete without some level of healthy anxiety. Anxiety is this thing that, you hear it and people are like,
raising my hand.
Like, oh, that's bad. I have a problem. And I'm like, there's a healthy level. If you don't have any, those are the people that they say, oh, talented, but like, don't go anywhere, because the drive isn't there. So there becomes a threshold where it's too little anxiety and too much anxiety. So, I think a lot of elite athletes border on that too much, because you do have to have that hyper-focused drive and that internal pressure. And so we definitely see that that happen in this group where, and then plus you're talking about somebody whose livelihood is potentially
totally
dependent on if they're performing. And if you concuss and you can't perform, then you have that other pice of it.
You can't relax. No matter how much they tell you to rest, you're not. You're just like, I'm not relaxed. And that also leads to, Rebecca was very comforted when she finally got an MRI, and I was just like, I don't think you need an MRI, but she did, to know that nothing was structurally wrong with her brain.
Yeah, it can be totally reassuring for some patients. It's this balance always of like, you don't want to overutilize medical resources. Sometimes it helps the patient. Sometimes it perpetuates this going down the rabbit hole of seeking more and more tests. But I mean, sometimes it's just like, okay, good. I know there's nothing structurally wrong.
Yeah.
There's no small bleed somebody missed. There's nothing in my brain that's going to give me problems later on. And that's great to just kind of check it off and make sure that we definitely see that in protracted cases. It's 100% not routine, needed to be in a routine way. Like, I have people who come to me a week after injury and they're like, I went to the ER and they didn't give me an MRI. I'm like, you didn't need an MRI. Like, you didn't have any need based on your presentation. So yeah, but sometimes if things last a long time, you got to do that testing and make sure there's nothing else going on.
Yeah. So let's dig into, I interviewed, as I mentioned, Chris Vaughn, who also presented on rest, which was a fascinating conversation about the history of rest. And that, I thought, teed up this conversation perfectly because, you really presented on sort of like how we're thinking about treatment, and that concussion treatment is actually active. You actively treat concussion. Yeah. So let's talk about what we know now, and is it dependent upon, he's like, we treat symptoms. And what I was hearing at the symposium is that concussions are also being categorized according to symptoms. Am I hearing that all correctly?
Yeah, you are. So when he says we treat symptoms, it's because we don't have any like objective markers like in the same sense of like imaging's normal, right? So like you don't have a spot to focus on, or if you're talking about a broken bone, you can take a picture of that, see it, and put it back together. For a concussion, you have to let the symptoms guide you, but we've moved so much farther beyond symptoms now, where we have some measures, clinical measures that measure concussion. But there's noise in the background, right? So like you can measure cognitive function, but cognitive function can't be measured in isolation if you have attention problems or depression, or you have such a bad headache that you can't focus. So certainly there's other factors, but now we do have more objective measures, and it's the symptoms plus the findings on these more objective measures that help you kind of categorize them, right? Okay. I mean, there's people who are very somatic and focus on all the symptoms, and they endorse everything, but then you can see, it's actually more of this or that. So I think that symptoms alone are really limited. But if you can kind of couple the symptoms with the findings on testing, then you're going to be able to lead down a treatment plan a little bit better and kind of better speak to the patient on, here's what your primary deficit or problem is, and this is why you're getting symptoms from this problem. So they correspond. Like, almost everyone who has a convergence issue gets a frontal headache.
So what does that mean?
So a convergence issue, this is just an example of one type of ocular motor problem you can have. Bringing your eyes together and apart is something we do all day. We have to focus at stuff that's really close to us and then shift our gaze to stuff far apart. If that's a problem, you get issues with reading and computer work. But a lot of times those individuals get a frontal headache. So one thing I might ask is, where's your headache at and when do you get it? Because if they're getting it specifically triggered by reading and it's in the front, it's not 100% like predictive that that's going to be their problem, but we have some relationships and correlations there that help you lead down the right path. So symptoms are absolutely important, and then they can help you guide you to like what to look for as well, if that makes sense.
That makes 100% sense. So, when you delivered the profile subtype sort of in the conference, it was like vestibular, ocular motor, cognitive, mood anxiety, post-traumatic migraine. Can you give me sort of a high level idea of sort of like what the objective measurements you're talking about is, and then like how you put them into these profiles?
Yeah, sure. So some are more subjective than objective. So to give you an example, anxiety, there's no way, anxiety and mood issues. There's not really a way to measure those other than to ask the person. That's a subjective experience thing. So that's something that's going to be more straightforward. And we know we have standardized inventory that can give you like severity, like, are you having a normal amount of anxiety or a severe amount or whatever? Similarly with migraines, there's migraine inventories, but it's really, do you experience a headache or not? There's not any way to and they, a certain classification of headache, there's certain criteria with the intensity level and the comorbid nausea with the light, noise, and sensitivities and stuff. So some of that is more symptom driven, and it's not as much of an objective procedure here. Now, if you're trying to find a vestibular issue, you can do, like, for example, the VOMs, and then you could see, can you provoke dizziness in the pattern you would think if it's a vestibular issue versus, I just stand up and I get lightheaded. That might be more of an orthostatic issue. So there's these measures that can help differentiate where the dizziness is coming from.
Can you explain that a little more in plain English?
Yeah.
The VOMs.
Okay. Yes, absolutely. So that is a big and emerging thing that we missed for a while, for years. I mean, we've known about vestibular and ocular issues for over, I don't know, a decade now, but it was something people didn't evaluate, say, maybe more than 10 years ago, 15 years ago. So you can see if that reflex with the head and eye movements is working right. You could see if tracking pursuits, meaning the way you move your eyes, you can converge and diverge your eyes. You can screen for problems with that. And that's very sensitive to concussion. It's not the only thing that would cause those issues, but in otherwise healthy athletic populations, you're very rarely going to see any other reason to have those issues. Once in a while, if you have somebody that has a developmental issue with their eye, like a strabismus or an amblyopia or something like that, they might have that issue before, but you'll probably know that. They'll be able to tell you that history. So in any case, that's one major area of testing. We use the VOMs. There's some other, ways to look at things. And then if you send to a vestibular specialist, they go beyond that with their more in-depth testing, which is beyond what, I could really even explain to you. But yeah, so that's one way. And then that looks at the vestibular and ocular. And that's one of the main ways to test for that, in conjunction with asking them about their symptoms. So with a vestibular issue, I'd expect them to get dizzy with quick head movements. So it might be during dynamic exercise if they're an athlete. Sometimes with visual motion sensitivity, you'll notice people are like, I'm fine. And then I go somewhere like a cafeteria at school, or I go to the grocery store, and then I am totally overstimulated and it's terrible.
Yeah.
So that would be an example of like a way to kind of put those findings together, right? And same with like ocular. I gave you an example earlier with like the reading, and then looking at the convergence or the saccades and or ability tracking pursuits.
Is cognitive just brain fog?
Good question. So I think of cognitive has long been known, because I think the cognitive piece comes more generally from other issues happening in the brain. So you could talk about like cognitive issues coming from the vestibular system. So if you move and you can't focus and you get overstimulated, people feel super foggy and detached and can't focus. So yeah, then they have cognitive issues. If you can't read because of an ocular issue, or you have to keep rereading, you're going to feel like you have cognitive issues too. You're not encoding and retaining information.
Right.
Plus, the visual system really orients your attention. And if it's not working right, people in general feel like they can't pay attention as well. And then there's also like the pain factor, right? If you're in pain, you feel cognitive isn't right. If you're super anxious and on edge, you can't focus. Like, if someone puts you on the spot and you're all stressed out, all of a sudden cognitively you can't function well, right? You can't think. You're like, you can't find words. It's like the person that has to do public speaking and is getting super anxious beforehand. All of a sudden they freeze and they can't freeze.
Yeah.
And that affects your cognition. So I think almost every problem with concussion affects your cognition.
Yeah.
And then there's, when we talk about more severe brain injuries, or not usually concussion, but if like you talk about something where you can see on high the resolution imaging, like brain shearing, or a small bleed and stuff, then you're talking about more structural or microstructural damage that might interfere with cognition. Although, if I'm being completely honest, a lot of times the outcomes with those patients isn't much different. So
yeah,
I think unless you have a severe TBI and you're talking about true brain damage, then cognitively those people have pretty significant issues that may not recover. But if you can figure out where the cognitive issues are coming from with a concussion, then you can treat accordingly. But yeah, that's why cognitive issues have been known forever, because I feel like they're always so pervasive. They always come up, and they're very noticeable, right? If you get hit in the head and then you're disoriented, that's probably not the same mechanism that you're having later. It's just that your brain metabolism is not working and your blood flow is not working and you can't function at the moment. So
Do we know why
that's
why it's an energy crisis per se? Like why the brain, is it just the brain is using more energy because it's trying to heal itself, or the cells aren't kicking in?
When you have the force, your brain sloshes in the skull, and then the cell membranes get stretched, and then there's like potassium and calcium and these special pumps that are keeping your cells running the right amount, and those chemicals leak out then because of the stretching, and it dysregulates the blood flow, and there's a bunch of downstream effects. And certainly some kind of biologist who bench scientist who does this work could give you more details, but yeah, it's very much leads to this neurochemical problem that in animal research, at least, we see actually resolves pretty quick, maybe a week or a couple weeks, and you're not seeing these changes acutely. But again, obviously not nobody, but a lot of people are not clinically better from a concussion in that time frame that we can capture the metabolic changes.
Gotcha. So let's pivot and talk about some of these universal treatment approaches, because, what I heard very loudly and clearly is it's not just like put yourself in a cocoon away from the world, like we want to approach with active approach with relative rest after 24 to 48 hours is the first thing I heard.
Exactly. So I think the resting gets, and I won't belabor rest because he's already talked about it with you, but that whole resting got started because we want to remove people from play to keep them safe right after injury, right? And absolutely that's important. We know if you stay in play with an acute concussion that happened that day, that is bad. Getting hit in the head is bad while you're injured. Or maybe even getting your heart rate up that same day is bad, or continuing to exercise. That needs to be further researched. But in any case, it's bad if you're exercising that first day that it happened. But then, then we do know that 24, 48 hours maybe is the maximum amount of time that we're really seeing benefit. So it's kind of like other injuries, but we've taken it too far. Like, if you break your ankle, you probably have to rest for a bit and get it casted. But then after that, it's not like you just wake up one day and you're better. It's like I tell patients, this is not a cold or the flu. You don't just rest for a few days or a week and then you wake up and you're fine. This is going to take some work and some rehab. So very much it's active. It's rehabbing just like any other injury. If you talk to an athlete, unless it's the most minor of injuries, there's going to be a rehab part of it. Nobody's just like resting and then returning to their sport. You don't break something and then bike 100%, do a trial, ride or something. So,
but even like a hip, and like if you get your hip replaced, they get you out of bed pretty quickly now. I mean, you're not like running a marathon the next day, but they get you moving. They're like, you got to get up.
Exactly. So I feel like the concussion recommendations kind of lag behind that, but that's what you have to do. We have to get someone up and going, and you have to understand it's not going to be 100% capacity, but I have to explain to patients every day, this isn't like a fun process. This is, if you have discomfort, you should. No, we don't want you to feel tortured and miserable where you can't function the rest of the day, but you need to push on the symptoms and feel them a little bit to let the brain know you are going to adapt and move forward and get better.
And is that what non-avoidant means? Non-avoidant approach day to day?
And that's my own just personal term, but I would say it's not avoidant of like things that trigger symptoms.
Like go to the grocery store at least a little bit? Is that what you're kind of saying?
Exactly. I say start with a small list, maybe go when it's a little bit less busy if it's, a recent injury or you're just starting with your rehab process, and then build on it, right? Like, I mean, I like to go to the grocery store once a week. I don't want to go more than that. So I have a million things on my list and I go. If I had a concussion, I might have to change that approach. And I tell patients, like, that's okay. It's just temporary. We're going to build you back up to getting all your groceries at once. And so trying to speak to them in a way of like a plan that's going to work for the week, and then we'll try more the next week. But that's the kind of general principle of it. And I will add, the tricky thing is if you avoid something, you will feel better, and patients get tricked into thinking it was helping them. So if I see someone 2 weeks post-injury, they're like, I was resting, I was thinking, I was feeling so much better. And then now I just came here and I feel terrible. I had to drive, I had to take this testing. And I'm like, it was a false sense of better. Now, if you want to live the rest of your life at home doing nothing, then that's fine. But most people don't. So if you want to get back to living your life and the activities you want to do, you got to do them, and probably just have to do them in a modified way for a short period until you can do them normally again.
Yeah, no, it's a great way to put it. And then what did you mean by behavioral regulation and lifestyle factors?
Yeah. So sometimes people think, oh, well, they told me to go home and rest. I'm going to sleep as much as I can. I am going to change my diet to some kind of special concussion diet I found online, or I'm going to start intermittent fasting because I heard that was good. Just start to Google stuff that's healthy. And I'm like, no, you need to regulate to your normal schedule. You need to eat regularly, drink a lot of water. I mean, maybe if someone's normally dehydrated, I'm not going to encourage them. I'm going to say drink a lot of water, because not being dehydrated can only worsen a headache, can't improve it. Sleeping normal is a huge one. If somebody's not getting enough sleep normally, like say they're like, well, I only sleep 5 hours. No, I'm not going to tell them, okay, just sleep 5 hours.
Right.
But I don't want people sleeping 13 hours or 12, even probably 12 or 11, the most is like a teenager, maybe can sleep 9 or 10, and that's still considered healthy.
Yeah.
But generally speaking, we want adults to sleep a normal 7-8 hours.
Yeah.
If they are unwilling to meet me on that, and then I say, okay, if you fall asleep 20 minutes, you need to set an alarm and during the day, because power naps don't really disrupt your sleep cycle.
Right.
But most people just can't stick to them.
Yeah.
So I'm like, if you absolutely are like, I'm not going to do that, I need to take the nap. And I'm like, well, can you try at least just a 20-minute nap or something?
Yeah.
So that would be like my compromise or recommendation if they're they're like, I can't stay awake or something.
Gotcha.
But really, and I tell them, I don't care if you are in bed 12 to 8 and you only sleep 4 to 8. Sorry, you just got to get up and reset it next night, because the way people start to get insomnia is by dysregulating their cycle, by thinking they're going to sleep the next day and make up for the sleep they lost. Sorry, that's not how the brain works. It's not a piggy bank. You can't just store your sleep for later or get it whenever you want and, then not work for 2 weeks and then save your money. It's just, it just doesn't work like that. So I'm like, it's going to be rough if you didn't get a good night of sleep, but you really just got to get back in your schedule, especially if we're talking beyond the first week or so. I'm like, this is definitely not helping you to be all out of whack.
Yeah. Oh, for sure. So that's what I'm hearing. You're just trying to regulate them back to like a healthy, normal sleep wake time, regular meals, your 70 to 90 ounces of water per day,
and getting out for walks and stuff. So sometimes people think they're supposed to be resting. So they're like, well, I didn't want to walk or do too much exercise. And I'm like, listen, I'm not saying the first week post-injury you should be running and jogging. I mean, maybe if you're an athlete, yes, but like if you're just not even used to that, or you're maybe more of a recreational kind of athlete, and we just got to get you walking the first few days, because that actually is good for recovery, and it's good for mood and emotional, like your emotional well-being. People don't realize that if you don't move enough, how much more anxiety can creep up, or depressed mood if you're stuck in the house all day. So a lot of times I try to get patients to start the day with a walk. I'm like, get up, force yourself out of bed. It's going to be a rough 10 minutes getting yourself ready, and get outside. Yeah. And then get that walk in, and you're probably going to feel a little bit better and feel like you can move on with your day a little better.
Yeah. And I would, a lot of this audience is very active to begin with. So to be told not to move, and that came up in the symposium, is incredibly stressful.
Yeah. Yeah, absolutely. There's no reason for it. It's not been supported. In fact, we're more and more getting down to the fact that like, oh, now we're doing RCTs with people exercising at 3 or 4 days, and it's great. So there's no reason for it.
Yeah. I guess the one question I have is if, because Rebecca, what she was running into specifically was the headache thing. And if something is driving a headache, that's kind of, how do you help people bump into, push into that symptom, as you say, because that does seem like your body's telling you like, I don't like this. I don't like this. Absolutely.
And depends on where the headache's coming from, right? So if it's triggered by the exercise and dynamic, like for example, biking, if it was like turning your head and looking around, it's probably a vestibular issue. And then you might have to back off and start with more basic vestibular exercises and stationary bike or something.
Gotcha.
If it's pushing back that hard, the goal is to strike the balance. You want to push so you're a little uncomfortable, but by no means do we want somebody to have such a bad headache they can't function. And so sometimes you run into that problem where someone is just a headachy person or really prone to bad headaches, and they're getting these migraines that are really interrupting their recovery trajectory. And I wouldn't say this is the most common thing, but sometimes we need to get a neurologist on board for headache medication.
Yeah. Yeah.
Especially if somebody's already like very prone to migraines and just they're behaviorally trying to do everything they can, and it's just not working. Like they're sleeping enough, they're doing their light exercise, and they're still getting so many migraines that then they aren't able to progress with the vestibular therapy, and then they're not able to then ride their bike. So it's kind of like we work down our priority of treatments to least invasive to more invasive, right? Like I never say headache medicines are the main thing to do, because they can be really helpful for some people, but almost everyone experiences some kind of side effect. You have to get on and off the medication, so it's not like the first thing we go to for sure. And we always want to fix the underlying problem before we're trying to throw a medication at it to mask the symptom.
Yeah, that
so
makes a lot
first
of
we're
sense.
trying to be like, is this an ocular problem causing your headache? Let's fix your eyes. Is this a vestibular problem causing your headache? Let's fix that.
Makes sense. That makes 100% sense. Where does the neck come into this? Because she did have a neck, some serious neck stiffness and neck, and there's got to be a component there, right?
Absolutely. Oh, it's so funny. Before we used to be like, okay, like how do you separate those injuries? Now we kind of like a whiplash with the cervical component. It used to be almost thought of as a like kind of a profile of concussion, but really it when you're talking about a cerebral concussion, you're talking about the brain and the blood flow, and like the neck is separate, but it can overlap with so many symptoms. It can make your job really tough. So you can get headaches, and sometimes they're posterior and it clues you in, but sometimes you're talking about like it wraps up and then it's behind your eye. And then it can be tricky because, you work someone out and they get a headache. Is it because of they have exertion intolerances because of vestibular issues? Is it because they were just now using their neck a bunch and now it triggered the headache? But it can be a huge barrier, because if they're just doing anything or sitting at a computer hunched over all day, then they get the headache. It can be really difficult to figure that out. And PT for neck pain doesn't always work. So at some point, if everything else is testing normal and the patient still has a headache and it's not falling in a pattern that's suggestive of a concussion problem, then you're going to be like, well, by process of elimination, we need to further explore if this is your neck. And then, patients can go way down you see like the more aggressive treatments, like, oh, let's do injections, certain blocks, Botox. I mean, there's stuff that people do. And yeah, unfortunately, once you have like, a chronic muscular issue or any even, which is kind of considered not a big deal, you can see these chronic headaches until that calms down.
Yeah.
So a lot of times people do need to be doing like cervical PT as well. And then if that doesn't work, I'll send them to like physical medicine and rehab and to explore additional options. But huge factor. And I, there's people certainly that go around probably thinking they have a concussion forever, and they really have a chronic whiplash injury that's triggering migraines.
Yeah.
And
that's good to know.
we know that cervical pain can trigger what looks like a migraine headache. You can get the light sensitivity, you can get pounding headache, the nausea. And so there's a lot that goes on. And, similarly with people with other types of nerve related, like if you see somebody who gets crushed by a baseball in the face, I saw someone who's like, I only have like a searing, stinging pain right here. I don't really think it's a headache, but it generates a headache. And I could find nothing concussion wise wrong. And I'm like, listen, you got this headache from being hit, but I don't know that I'm going to call this a concussion headache. There's nothing we can treat here. There's not the underlying physiology here is probably more of a superficial, like, you got crushed in the face and your face hurts.
Yeah.
And I know it's giving you a headache, but us doing vestibular therapy, you're not dizzy. It's not going to help your headache. So there's situations like that where it's not a clear cut concussion only, especially with trauma where you've hit body parts very hard and didn't have a helmet on. And we're not just talking about force applied in the helmet. We're talking about like, something a little bit more in deep, a lot more involved, where like your skull hit against concrete,
Yeah.
or your face got hit by a ball or whatever. So
Yeah. So then to bring this to somebody who is listening, like if a listener, and I hope this doesn't happen to anybody, but if they go over their handlebars or hit their head or do any of the
Yeah.
number of things you can do, like
Mhm.
what should one do? Like, should you wear,
yeah.
because I've seen it over and over, Alicia, like
Yeah.
people go and they get terrible care. They get bad advice and terrible care.
Yeah, absolutely. Yeah. So first thing is go to the hospital if you have loss of consciousness, like multiple episodes of vomiting, any numbness, tingling, anything where there's slurred speech, disorientation. A lot of times it will be fine. They image you and it is just a concussion. But the first thing with that kind of mechanism of injury, if it's a bicycle accident, it's severe enough to cause something else. So make sure you go to the hospital, rule it out. If you go over your handlebars and you get a little headache and dizzy and nothing else, you probably don't need to go to the hospital. I do say earlier care is better, but like you said, if it's early terrible care, then it's not better. So, chill that day, 24 hours, and then gradually get going into some normal everyday activities. You really can't hurt yourself. You can make your symptoms a little bit worse. The only thing people shouldn't do before seeing a medical professional is anything high risk where they could hit their head. So
Right.
don't go back to your sport full go if
Don't send it. Don't go out on your bike and start.
Yeah, exactly. Yeah. If you were freshly concussed yesterday and you want to do something, get on a stationary bike, hook your bike up to those, whatever, excuse me, I'm not a real cyclist.
That's fine.
The indoor thing. And you just do your thing if you need to get on your bike. But yeah, so just play it smart and then get into someone who knows what they're doing and get treatment, especially if you're not better in that first couple days. Ideally, everybody should get a workup if they're an athlete to make sure they're not missing anything, because you get athletes who, as anxious as we see them, we see the other thing where you're like so hyper focused that you can block out everything because you so badly want to be back doing your thing and you can try to like almost ignore it.
Yeah.
So I've seen athletes who say they're 100% fine. I don't think they're lying, but they're not okay. So they just are unaware of these subtle things. So ideally, you want everybody to see somebody to be cleared. But like, again, in speaking to the fact that we see people get really bad care, if somebody tells you just to rest until you're better, run away and go find somebody who does rehab and treatments.
Good advice.
Go on the computer. If you get a headache, you got a little headache, raises by 1 to 3 or 4, then take a break, come back down and go back at it.
Gotcha.
After you're feeling a little bit better. You don't have to stay in bed all day. I tell people, first 24, 48 hours, if your body's telling you to rest, fine. But then you need to get your butt in gear.
Hey, it's Celine breaking in here to say that if you're feeling a little freaked out over all of this, you are not alone. The more I learned about women like Rebecca suffering from these kinds of post-concussive symptoms, the more concerned I got as well. After all, I have hit the ground and my head my fair share of times while out mountain biking and snowboarding. So I pulled what we learned into a simple guide that explains what concussion is, how to know if you have one, and what to do if you do. It's called The Active Woman's Guide to Concussion, and you can download it for free through Feisty Women's Performance. I will put a clickable link in the show notes in each and every episode to make it easy to find and access. Thanks for listening, stay feisty, and stay safe. Okay, Rebecca, you've had a chance to listen to my interview with Alicia Trbovich, and I thought she was really great. I mean, I am excited that there are people like her in the world. What did you take from this?
Well, I took a couple things. First, I, was a little sad that I didn't have someone like her to guide me through this process. I mean, we're going on almost 3 years now since my crash. And so at first I was like, I wish, why didn't I find her? But I also was really hopeful because I was like, okay, there are people who are specializing in this area. There are people who have knowledge. And so much of the time during, my sort of grasping for treatments and asking people, they just kept saying, well, there's so much we don't know, and that we just really don't have a product. We just really don't know anything. And she just blew that out of the water and said, no, we do know a lot of things. There's a lot of studies, and there are specialists who work in concussion and sports related concussion. And luckily, I did find, one of those practitioners a year in, but, so I was a little sad and was a little hopeful, basically listening to her conversation. And she did reinforce for me that even if there are things that we don't know about the brain or science doesn't know about the brain, you can still treat the symptoms, and then that does get to the source. And I was encouraged by that, and just again sort of like, why did nobody advise me during my process? But that's the point of this podcast and this education, is to let people know that there is help out there. And so I really liked her conversation. I liked how smart she was. I liked how she was really matter of fact about, this is how we treat a concussion based on, do you present with ocular, vestibular, different types of symptoms that you're presenting. And somebody might have a myriad, but you can target it a little more instead of just like, well, we don't know. So I was encouraged by her conversation that there is help out there, there is treatment out there, and people just need to find it, which seems to be the hard part.
Yeah, for sure. And she reiterated that herself, that it is hard. And I also liked how sort of like Christopher Vaughn, she was sort of talking about how it's not dissimilar to other kinds of PT where you lean into that discomfort a bit, not to torture yourself, but just to like get your brain back to like, okay, this is where we're trying to get back to baseline here.
Yeah, and look, if I'd had somebody guiding my recovery that could reinforce and say,
Yeah.
okay, here's how you're presenting, here's your PT, basically, and then report back to me and let me know how it goes. Like that's what you would do with a knee injury or anything else. And I think had I had somebody who was actually managing my care, who was a specialist in this area, I would have recovered a lot faster because I would have had the confidence
Yeah.
to say, oh, okay. And then I would have had the reassurance for someone like her to say, well, this is normal. This is what we see in a lot of concussions. This is, maybe your timeline's a little longer, but you can expect this, this, and this. And when I finally did see Dr. Kutcher, that's what was reassuring, is he finally said, look, some of your multitasking and some of these cognitive things will be the last thing to come online. And so I was like, oh, okay. So someone, a specialist, can reassure you that the timeline you're on or the things that you're doing are things they've seen before, and to keep going and to keep pushing. And so having that feedback, I think, is really, really important. I think about the subjective and the objective reinforcement. Objective is like, okay, my sleep has improved. I'm tracking that with an Aura ring. Subjective, I still feel kind of unmotivated, and I'm not, I don't want to get out and ride my bike. And I really needed and craved, and I think most people, a combination of those things. I needed some measures that were like, yes, you're doing better, because the progress is so slow, and I couldn't see progress. I've looked back at my journals, and it's like heart-wrenching to read the words that I wrote, and just like, if somebody had said, no, you're on the right path, you're doing okay, it would have been so reassuring, and it would have kept me from having anxiety and depression and all these mood things that were coming up because I wasn't getting good treatment. So I was actually making my concussion symptoms worse because I didn't have a specialist guiding me and reinforcing me and helping me.
Yeah. Yeah. And I also, along those lines, thought it was interesting, how when they talk about the types of concussion, the sort of the proclivities you might have yourself can lead to whatever type of concussion you might have. For example, like I didn't know that you had migraines as a kid, when we started this podcast, but you have those terrible headaches, with your post-concussive symptoms. So that a light bulb went on when she was saying that. I was like, oh, okay.
And that's why, if everyone can get a baseline MRI, if everyone can go to a specialist and say, hey, I had migraines as a kid. And actually, Dr. Edith did finally ask me that. She's like, tell me about this, that. And yeah, your brain has, sort of a DNA and a template. And when you disrupt it with a concussion, it can bring out things that are already there in you that you're, been part of your life. And a specialist would know the questions to ask and say, okay, you had migraine, so we're going to expect you might have headaches, from your concussion, or, you had anxiety, so that might come up as a little stronger symptom for you. I thought that was really important. It just goes to understanding yourself and having a specialist ask you those targeted questions of your personal history and keeping track of them. I mean, I just had no idea. And like, quite honestly, half the time I thought I was crazy. I thought it was all in my head. I didn't even want to communicate some of my symptoms because I just didn't know what was going on. I didn't have anybody helping me.
Well, and you also have a brain injury, right? Which is making you unmotivated and depressed and anxious, which makes it hard to, care for yourself without somebody sort of guiding you through that process. And like when you were saying, also having somebody asking the right questions, also asking about your neck, asking structural, that stuff that she also brought up. I mean, like having one human being to do all that is, I think, very important.
Yeah, and you can't navigate your own healthcare anyway, but especially with the brain injury.
When you're 100%.
Yeah, I mean, it's really hard. And so having a medical specialist who's an advocate, having a family member who's an advocate, having people around you that know the right questions to ask. And, hopefully I never have another one again. But the hope is through this process, people are going to be able to say, okay, ask this, 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 and this. The neck thing it's so obvious. If somebody falls and hits their head with enough force to break their helmet, there are body parts that are connected to your head. And so, not evaluating my neck right away, that just seems insane. And, my primary care physician, I don't expect her to be a specialist in everything. They have a big, heavy job, but all she could have done is referred me to a specialist. And then they would have asked those questions. But, I just didn't know. And I sort of got cleared by, a doctor, but not a specialist in concussion.
Yeah. Well, I think that's a good place to wrap this episode up. We will be doing a full what to do when you hit your head wrap up, at the end of this podcast series. But onward to episode 3, which I think a lot of people are going to find really interesting.
Yeah, and I'm learning a lot through this. So I just want to, thank you, Celine and Momentous and everyone who's making this possible.
Yeah.
I'm learning a lot about what I could have done differently, what I did well. I did some things right, not all the things right, but just providing, some information for people and a little bit of a trail map for people to navigate, and friends and family to navigate an injury like this, which is quite a common injury. So I'm really excited about the conversations we're having and can't wait till the next one.
All right. Thanks so much. Well, that's our show. You can find a full set of resources in the show notes, including the universal treatment approaches and behavioral and lifestyle recommendations Alicia outlined during our conversation. Join us next week when we talk about Rebecca's journey into talk therapy, including psychedelic-assisted sessions that, though still controversial, she felt were a major turning point on her road to recovery.